Hello everyone, and welcome to another audio podcast. In this series, in this particular series, as part of another a radio edition, and this is an audio podcast as part of a Labside Archetype edition, and this is an audio podcast as part of a Labside Alchemy and part of an audio podcast as part of a Bostix Blast. This is an audio podcast as part of another Storm Robotics production. Labside Alchemy audio podcast, there'll be an overview in around works from 2021, looking at mainstream media to prompt transplantation, and looking at this works from a sort of from an ethics perspective, and a healthcare science stance. This works was originally peer-reviewed and published in a scientific and sort of medical journal in around 2021, and also was presented as a research poster presentation at an ethics conference, a research ethics conference that took place in mid 2021. And so the overview is as thus. So the use of social media today provides unparalleled opportunities to provide and receive education, access to communication, etc. And so social media and mainstream media, such as television, newspapers, magazines, and radio stations, are also being used or have been used to prompt education surrounding specific long-term conditions. Certainly, the use of social media is not limited by constraints of time and geography. So the aims in around this works were three particular specific questions will be prompted. Number one, is there an Islamic stance on using social media or mainstream media to prompt transplantation education? Number two, can Muslims donate their organs? And three, does the healthcare scientist, in context of those specialists or those health professionals in laboratory medicine and pathology, have a role providing the public education surrounding organ transplantation, in around organ transplantation? So, chronic kidney disease, or CKD, is used to provide a long-term or long-standing condition example. So, in around the review of this, there is a need or a requirement for a multi-channel approaches, so that the issue is a more broadly known social norm in context of primary care, where healthcare scientists will know or should know underlying pathologies. In context of what is referred to as the Islamic stance, if a Muslim decides to donate an organ, they must do so out of free will, without being morally or socially forced, and without economic pressures. If the deceased Muslim indicated during life in a will, for example, that they do not want to donate organs, then no one is authorized so on the deceased person's behalf. Now, in context of the healthcare scientist, role on the basis, more educational campaigns through social media or mainstream media involving healthcare scientists and those Muslim communities or faith communities are required. So, in around the discussion of this works, bridging gaps in around health literacy is also important. This is where healthcare scientists have an important role to provide health science transparency where other health professionals are challenged. Clarity of terminology to increase health literacy on topics relating or regarding to transplantation is now especially required owing to more time being spent online, where in context of the public spending more time online. Number one, the Islamic, in part in answering the questions as part of this works. Number one, the Islamic stance on the use of social media to prompt organ donation organ transplantation and education has not been investigated in depth. Number two, Muslims can donate organs, and three, there is a role for healthcare scientists to provide education. However, more research is also required to shed light on what is most effective, what is an effective approach, what is an effective approach for healthcare scientists, and specifically the sort of specifics around laboratory medicine and pathology, laboratory medicine and in around pathology, and sort of in around aspects of immunology and serology as well. So thank you for tuning in. This has been an audio podcast in around an overview and looking at mainstream media, looking at social media, mainstream media to prompt transplantation, and looking at this works from ethics and healthcare science stance. And this has been an audio podcast as part of a Labside Archetype, as part of a Labside Alchemy, and this has been an audio podcast as part of a Bostic Blast. Thank you for tuning in.